Nighttime urination, often called nocturia, becomes more common with age, but it is not always a simple sign of aging. Waking up twice or more at night to urinate can reflect changes in hormones, bladder sensitivity, sleep patterns, and daily habits. Although many people assume they must tolerate it, nocturia is connected to cardiovascular health, cognitive changes, and increased fall risk in older adults. Understanding why it happens and what habits can help may improve sleep and reduce complications. As individuals age, two main mechanisms contribute to increased nighttime urination. The first involves reduced nighttime release of a hormone that helps the kidneys produce less urine during sleep. Younger adults typically release higher levels of antidiuretic hormone at night, which slows urine production and supports uninterrupted sleep. With age, the nighttime peak declines, and the kidneys continue producing urine as if it were daytime. As a result, even modest fluid intake may lead to bladder filling during sleep. The second mechanism relates to bladder sensory changes. The bladder wall contains nerves that detect stretching as urine accumulates. In younger adults, the bladder generally fills to a relatively larger volume before signaling the need to void. In older adults, bladder sensitivity may increase, causing the urge to arise earlier at smaller volumes. For many, the actual urine amount at night is not large, but the urgency and discomfort of the signal interrupt sleep. This combination of increased production and heightened sensitivity makes nighttime awakenings more likely. Behavioral patterns can reinforce nocturia. Many adults use the bathroom just in case before bed, even without urgency. Over time, the bladder learns to empty at reduced volumes, lowering its functional capacity, conditioning the bladder to tolerate slightly. Higher volumes can reduce nighttime awakenings, though this must be balanced with comfort and individual medical conditions. Nocturia is not only a matter of inconvenience. It affects sleep architecture, cardiovascular function, cognitive health, and physical safety. During normal deep sleep, blood pressure drops by approximately 10–20%, allowing the cardiovascular system to rest. When sleep is repeatedly interrupted, this drop may not occur effectively. Studies have shown that individuals who wake multiple times at night to urinate have higher rates of cardiovascular events, including heart attack and stroke. The early morning hours, when blood pressure rises, in preparation for waking, appear particularly vulnerable. Interrupted sleep combined with chronic nighttime sympathetic activation may intensify cardiovascular strain. Cognitive function may also be influenced. Deep sleep supports the brain's clearance of metabolic waste through lymphatic flow. When nocturia disrupts sleep cycles, this clearance may be impaired. Several observational studies have associated disrupted sleep with accelerated memory, decline, and increased dementia risk. Although nocturia is only one of many contributing factors, memory lapses, word-finding difficulty, and slowed processing may become more noticeable when sleep quality declines chronically. Fall risk is an immediate concern. Nighttime trips to the bathroom involve navigating dark rooms, unstable gait, and partial alertness. Older adults are more susceptible to balance problems, joint pain, and reduced vision. Hip fractures, especially in the elderly, lead to prolonged recovery, loss of independence, and increased mortality. For this reason, nocturia should not be viewed as harmless, particularly when paired with frailty or limited mobility. Several common assumptions about nocturia deserve reconsideration. Completely avoiding evening fluids does not necessarily reduce nighttime urination. Severely restricting hydration can concentrate urine, irritating the bladder and worsening urgency. Instead, shifting hydration earlier in the day and modestly reducing late evening intake is more effective. Another misconception is that eliminating caffeine alone solves the problem. While caffeine can irritate the bladder, alcohol has a more pronounced effect by inhibiting hormones that suppress nighttime urine production and directly stimulating bladder sensitivity. The belief that aging guarantees nocturia is partially accurate, but its severity varies significantly among individuals. Lifestyle, hydration patterns, sleep habits, and comorbid conditions all influence expression. Although aging cannot be reversed, symptoms can often be mitigated. Conversely, bladder strengthening through aggressive holding is not advisable. Excessive retention stretches the bladder, weakens contractility, and raises infection risk. Pharmacologic treatment may be important in cases involving prostate enlargement, overactive bladder, or other pathology, but lifestyle adjustment is a reasonable initial step for many adults. A simple bedtime practice may support smoother nighttime sleep. Consuming a small amount of honey, half a banana, or approximately 7 plain almonds 30-40 minutes before bed may stabilize blood sugar overnight, support parasympathetic relaxation, and reduce bladder irritation for some individuals. These foods provide modest glucose or minerals that help prevent overnight drops in blood sugar, which can otherwise trigger stress-related awakening. Honey should be avoided or discussed with a clinician in individuals with diabetes or impaired glucose regulation. To test whether this routine helps, consistency is essential. Taking one of the 3 options without additional fluids for 1-2 weeks allows time to observe changes, keeping a simple record of nighttime. Awakenings can help differentiate improvement. Even a reduction from 3 awakenings to 2 can improve sleep, continuity, and morning function. The goal is not perfection, but incremental relief. Evening behaviors amplify or hinder results. Finishing dinner earlier, ideally before 7 p.m., reduces digestive load during the hours when the body transitions into rest. Heavy or late meals delay autonomic shift toward parasympathetic dominance. Reducing fluid intake in the final 2 hours before bed, rather than eliminating all evening fluids, strikes a more balanced approach. Bright light exposure before sleep interferes with melatonin release and prolongs wakefulness. Dimming lights and reducing screen time aids natural transitions. Avoiding just-in-case bathroom visits retrains bladder expectations. Sleep position adjustments and use of small knee pillows may improve comfort and reduce abdominal pressure. Daytime habits also matter. Exposure to morning sunlight for 20-30 minutes strengthens circadian signals, making nighttime sleep easier and more consolidated. Distributing hydration predominantly earlier in the day reduces nocturnal urgency. Light exercise, such as walking, supports cardiovascular regulation and autonomic balance. Pelvic floor exercises may improve bladder control. Limiting naps to 10-20 minutes and avoiding late afternoon. Sleep prevents interference with nocturnal deep sleep. 3 points summarize nocturia management. First, frequent nighttime urination is not solely a consequence of aging. Hormonal changes, bladder sensory shifts, and behavioral conditioning contribute to symptoms. Second, small dietary or routine modifications before bed may support more restful nights. Third, aligning evening and daytime habits with natural physiology improves sleep continuity and reduces complications. Sudden changes in symptoms, the presence of blood or pain, or significant worsening require professional evaluation. Incremental improvement should be considered a meaningful goal. Reducing nighttime awakenings and improving return to sleep speed can enhance quality of life, daytime energy, and cognitive performance. For many individuals, recognizing nocturia as a physiological signal, not merely a nuisance, opens the door to more effective self-management and timely medical care when necessary.